Number one is TSH or TSH and T4 is enough to understand what's going on with your thyroid hormones. Research shows that your TSH reflects about 1% of the changes in your T3. So basically, it is meaningless. In addition to that, someone's TSH is completely invalidated once they're on levothyroxine. That medication skews your TSH. And in fact, the worse you are at using levothyroxine-based medications like Synthroid, Tirosine, Unithroid, Levoxyl, the better your labs will look if your doctor's just checking your TSH, even if they're checking your TSH and T4. So that's number one. Number two is normal does not equal optimal, right? Like you can be debilitated, literally on disability, and be in a normal range for what medicine says is okay. How do I know? I was that person and I serve these people every day. So you have to know what optimal ranges are. And again, like what Joe shared with my thyroid lab guide will give you our ranges that we openly share from Modern Thyroid Clinic of what we're looking for. And lastly, levothyroxine does not work for the vast majority of people, nor will it ever. It is a medication that I give an analogy of crude oil for. We don't put crude oil in our car to make it run. We need it to make gasoline to put in our car to make it run. Guess what? If we can't convert that crude oil to gasoline, we're not going anywhere in our car. And we are giving everyone in America, 90% of thyroid patients, crude oil with the expectation that they can convert it to gasoline, but most of them never can. They cannot and they never will. And so what that looks like is you still have thyroid symptoms, even though you're on medication and even though your labs, quote, look good. And lastly, let's see, what would my last one be? I would say, do not believe anyone ever. If I could leave people with one message today, do not ever believe someone when they tell you that your thyroid is normal and is not the cause of your symptoms, because there are dozens of reasons why it is. And 100% of our patients at Modern Thyroid Clinic have been told that, usually by like 2, 5, 12 doctors. And then they come and they get their lives back. And that is what you're looking for. You do not need to continue to have thyroid symptoms just because you have a thyroid problem.
Yeah, no, that's great. That's